Get ready with me as I head to the hospital today for my Salpingo, for my bilateral Salpingo oophorectomy, which is also known as removal of my ovaries and my fallopian tubes. I'm doing this surgery to prevent a further recurrence of ovarian cancer, which does not have any tests right now to detect it. This is in a bid to be proactive and save my life. This was me being prayed for a few days before the surgery. The boys woke me up. We said our good mornings, and then I sent them to go get ready for school while I got ready for the hospital. Under the leadership of their father, they formed a prayer ring around me. I was applying my organic facial oil that has over 20 ingredients, which are all organic anyway, botanical ingredients that helps my face to remain smooth and helps my skin color to pop after looking like I was burnt during cancer therapy. I made it personally. It's my brand. And over here I was busy preparing for the hospital. Airports check. I don't know if I should take this along because I'm not supposed to wear any jewelry. That's why there's nothing on my ears or anything. But well, I'll just take it along and put it in my bag when I get to the hospital and change and hand it inside this bag. You might be wondering what's inside this bag. It's my pillow I used when I had mastectomy because I had to lay upright. I could not lie down. I had to recline basically. So since we did not have a recliner, I had to use it. So this part of it was for my armrests. This was to lift up my feet so that they don't swell. And this was the main one for my back. The link is in my bio. The link to all the products I used is actually in my bio if you're interested. I just want to set up everywhere before I go so that I come back to everything already set up and not running helter-skelter. Jesus. I just want to set it up. I love pillows. And I love them. The bigger the better. My husband is tired of me and my pillows. But these bed sheets are from Nigeria, so the pillowcases don't really fit because the pillows are king size pillows. This is a queen pillow, so that's why it fits. I'm leaving to the hospital. My husband is my videographer for today. I just got to the hospital. My heart just dipped and fell into my stomach. But like my husband said, I should not be scared. God is with me. Jesus Christ, I'm here now.
And then 99% is that on my
So this is first room on the left.
All right.
Okay.
Thank you.
You're ready. Go change in the room. Blue down first, open at the back. House phone on top. This goes on. And then this is her phone number here.
Thank you.
Right now, I'm in the waiting area. We got in here at about 9 a.m. and I've checked in. I got my band. And then we came upstairs where I've changed into my... So I had to take off my Crocs here because I was not going to be allowed to take them into the theater, the operating room, like they call it over here. In fact, even when I came to the hospital this particular morning, I was on my period and I was told to take off my actual panties I came with, and I was given a disposable panties to wear. And the reason that this was done was because I was told that they would cut it off my waist, my panties off my waist if I take it in, as they did not need that. Over here, we're trying to find out where exactly or how exactly my husband will be informed that I was out of surgery, because they don't allow him or visitors, like they call them, to go to the particular area where the operating rooms are. They don't allow anybody to go there or around that place because it's still it's a distance from where we were. They had to wheel me and go through the doors, walk through that corridor, go down how many floors, or is it up how many floors? So, but they just don't allow. So this is where your visitor will stop with you, and then, of course, they would They will scan your bracelets to be sure that you're who you are supposed to be, and maybe check you in. Who knows what that device does. And this is when the nurse was explaining to my husband again on how to know on using the screens if what was happening to me. Was I in the operating room? Have they started with me? Am I in the recovery room? Can they come see me in the post-recovery room? Because even in the recovery room, that's where they monitor you. They monitor you to be sure that you're stable before they bring you out for your visitors to be able to see. And this is when I was being wheeled down that staircase, and then at some point we had to go and enter elevators and go to another floor and go in, like, it was basically a longer ride. So I don't know why they don't allow people to go into all those places, but well, it's the rules. This is when I came out of surgery, the post-recovery room, where my husband was allowed to see me, and then they were still monitoring me to be sure that I was okay to be discharged. My BP, my temperature, my pain levels. Could I sit up? Basically they were monitoring all my vitals to be sure that I was okay, and they needed to make sure that I was able to at least wee before I left the hospital. So this is when I was strong enough to try to wee, because they had to give me extra pain relief here to be sure that it will work, like morphine, to be sure that it will work for me in the house. And then when the pain had subsided, the nurse guided me to the hospital to go and wee, and so that she could check that off her list. And this is when we were leaving the hospital to go back home same day. Thank you for all your support so far. It means a lot to me.